After you have an embryo transfer, a certain number of days later, your healthcare provider will order a blood work pregnancy test for you. And you might be thinking, okay, I'm going to find out if I'm pregnant or not. And that certainly could be the case, but there's also a third completely terrible option where your HCG can be super low and you are what is called technically pregnant, which unfortunately is where we are at right now. And I've been here before. It really, really sucks. You just live in this limbo for sometimes weeks trying to figure out what is going on. But you know it's probably not going to be a healthy pregnancy, whatever it is. So yesterday was October 16th, 11 days post transfer for us. So I went in for my HCG blood draw. I was already kind of expecting bad news just because I had taken some urine pregnancy tests at home. On 8 days post transfer, I did get a positive and it looked pretty positive. So I was excited about that. And so for like a day, we were excited. We, tentatively, carefully excited, thinking like, oh, okay, yeah, this worked. This was finally the answer to what we needed. And then the next day I took another pregnancy test, just wanting to make sure that the line was getting darker, and the line was barely even visible. It was definitely lighter. So we knew whatever's happening, probably not good. So when I went in for my HCG level yesterday, they were hoping to see it over 100 and it was 8.5. Not even close. So when your HCG is low, one of three possible things can be happening. First, and what I think is probably most likely for us, is what's called a biochemical pregnancy, or sometimes people will just call it a chemical pregnancy, where there's an embryo, it briefly implants and then stops developing for whatever reason. And most often this happens with a poor quality embryo, a genetically abnormal embryo. And we know we had the best possible quality embryo and it was genetically normal. So that's definitely not what's going on. Sometimes this can also happen if the uterine lining isn't thick enough. Again, that was something we were monitoring. We knew my uterine lining looked great, so that's not the problem either. But yeah, with a chemical pregnancy, your pregnancy test is positive for a few days and then it goes negative again. Option number two, which I'm much more nervous about, and we have also been through before, is an ectopic pregnancy. So with my last pregnancy earlier this year, I went in for my first HCG level and it was 9.4. And then a few days later, it was 9.1. And then a week later, it was 14. And it just straggled on and on and on for 4 weeks. And by the time everything was said and done, I had had 14 blood draws, 3 different pelvic ultrasounds. We still couldn't see the pregnancy anywhere, but I was technically pregnant. I think the highest my HCG got to was like 500 and something. And usually you can't even see an ectopic pregnancy on ultrasound until the HCG hits 1200. So I had what was called a diagnostic D&C, where I went into the operating room. They cleared out my whole uterus. They did an HCG level right before surgery, and then they had me come back in 24 hours to do another HCG level. And because my HCG level went up after surgery, they knew then that the pregnancy had not been in my uterus and it was in one of my fallopian tubes. And so then I had to do methotrexate, which is an awful medication. It makes you feel terrible, and then you can't try to get pregnant again for 3 months because it's so toxic. So that's not a great option either. And you would think that an ectopic pregnancy isn't possible with IVF, but unfortunately it is. I'll show you guys the video again. When they shoot the embryo into my uterus, like they're aiming for the best part of my uterus, but they could accidentally shoot it into my fallopian tube. They don't really have that much control over it. So unfortunately, that's still a possibility. And then the third extremely unlikely possibility is that somehow miraculously this is a viable pregnancy. I really don't have hope for that because of how low the HCG is and because I've already seen the pregnancy test getting more faint. But because there's that, 1 in a million chance that somehow, some way a healthy baby forms, I can't stop my IVF meds. So I have to keep doing my nightly injections, which really sucks when I know that it's basically futile at this point. Until we figure out where that pregnancy is at and what is happening. So I'm going to go in for another HCG level tomorrow. at best case scenario at this point, I feel like the HCG has returned to zero and I get to stop living in limbo, because the times I've done this before, like I said, it took 4 weeks to figure out what was going on when I was having my ectopic. And it's just like you're in your own personal hell, because you want to be pregnant. You're technically pregnant, but it's not going to end with a baby. You can't move on. You can't start trying again. And you're stuck, and there's nothing that you can do. And it's so awful. I would not wish this on anyone. If you found this video because you're going through it, I'm so sorry. Yeah, I can't believe we're having to do this again right now. So we'll repeat the HCG level tomorrow and see what's going on. All right, so today is October 18th. We had the repeat HCG level this morning, and it is less than 2, which is negative. So I think that's the best we could have hoped for. I'm relieved that it's over and that I don't have to keep doing blood draw after blood draw after blood draw, and that it's not this like long drawn out process this time. But we are really disappointed. You try to guard your heart as much as possible when you've had losses in the past and you get a positive pregnancy test, but you do hope. You get hopeful and you get excited, and you just can't help but feel like, great, something finally worked. This was the answer. This was what we needed. And to have that immediately ripped from you is just like pouring salt in a wound. It's really rough. So thank you to everyone who's been really supportive and has had kind words to say. I have no idea when we'll get to try again. We have an appointment with our reproductive endocrinologist next week via Skype. So, we'll find out and make a game plan. I'm just really disappointed. I think next week I'm going to talk about taking care of yourself during a miscarriage, and, probably talk about miscarriage stuff for the next few weeks. So thanks for watching. Thanks for joining.